In recent times, natural disasters and disease outbreaks have struck various countries, increasing morbidity and mortality rates, with Ghana being one of the countries caught unprepared for the outbreak of some of these diseases. As part of efforts to improve preparedness and response to public health in the area, the Bono East Regional Health Directorate has adopted approaches such as strengthening the region's disease surveillance systems through capacity development and simulation exercises. Dr. Fred Adamaku-Boateng is the Regional Director of Health Services.
We know of late the kind of epidemic and outbreaks that we have gotten globally, and even including Ghana. We are aware of the famous COVID-19 pandemic, and even in Ghana we had Lassa, we even had Marburg disease. And you can also imagine most of the cases that we had during that time, Ebola, Marburg, and because people were not aware, the moment some people hear, oh, this is Ebola, this is likely to be Marburg, you see the reaction. Why were people reacting that way? They were reacting that way because they were not prepared. They were acting that way because of fear and panic. Because if you don't really know what you are dealing with, and even you don't know what to do when you see it, that's a challenge. And that necessitated us to do what we call simulation. Simulation is just to test the system to see, should you have a rare case, what will be the reaction? And not only that, so that people will be used to, and so that in the midst of that emergency, the response is faster, and that we're able to curtail and contain the epidemic.
He noted that the Directorate is working towards training all professionals within the health sector on quarterly basis to help curb the spread of viral diseases during outbreaks.
What we are planning to do is that now every district should run this simulation every quarter. What we did, all medical soups, all district directors were part of this exercise. And the idea is for them to learn and replicate it wherever they are going. And I think that if we begin to do this every quarter, look, nobody gets it right when it comes to emergency, but if you are prepared, it's better. And that's the lesson that we should learn. It's better, you are better prepared so that you can minimize or reduce the casualty. And that is the lesson that we have learned.
Medical Superintendent at the Kintampo Municipal Hospital, Dr. Anthony Chum, encouraged the public to visit nearby health facilities to report symptoms of viral hemorrhagic fevers to help curb a possible outbreak.
The point is that, as I said, it's a disease, it's a condition that mimics many other conditions. So when you see some of these things, you don't say that, oh, this one, it is just common cold. Come to the hospital, let's assess you, and then based on that, we can tell whether you have one or not. And for most of these instances, it is a suspicion. So we suspect first, and then we take samples, and then when you run it, if you are positive, then we'll let you know.
Dr. Anthony Chum was, however, quick to note that the facility has prepared adequately, and patients who come with such diseases will be taken care of.
As far as the staff are concerned, they are well educated. There's a lot of awareness within the facility, and therefore when the patient comes in, some questions are asked, and then if the person fits the criteria, then the other thing that we have to do follows.
Reporting for Joy News, Anas Sabit, Kintampo.